There has been literature dating back to the 1970s that patients with CLL are at an increased risk of second cancers, and that's for patients who are treated as well as patients who are untreated. We know that some of the treatments used in the past, for instance, alkylating chemotherapy or purine nucleoside analogs, are immunosuppressive and also pose a risk of acute myeloid leukemia. And we were interested, now that we have novel oral agents such as the BTK inhibitors, we were interested to see if the incidence of second cancers remains elevated and how much this contributes to morbidity in this patient population. So that was really the rationale for the study. We identified 691 patients that were treated with BTK inhibitors, and these were patients that were both previously treated and previously untreated, all with CLL. And the BTK inhibitors used were acalabrutinib and ibrutinib, so about 20% with acalabrutinib and 80% with ibrutinib. And we cataloged second primary malignancies, focusing primarily on excluding Richter syndrome, and we separated non-melanoma skin cancers from other solid cancers because non-melanoma skin cancers aren't included in cancer registries and generally are more of a localized problem compared with other invasive second cancers. And we found that, in fact, second cancers were the second leading cause of death in our cohort of patients, and we found that compared with the general population, the rates of second cancers remain significantly elevated in these patients receiving Bruton tyrosine kinase inhibitors.